for inviting me. I'm the Assistant Director for Children and Young People's Mental Health Services for Kent and Medway, and I've brought some colleagues with me today because I thought it's really important, perhaps not to hear from me as the overarching Assistant Director, but from the people that are on the ground. So I've got Lisa and Sue from SPA, I've got Isaac, Operational Manager, and I've got Kat from the Crisis team. So we'll try and do it as swiftly as we can. And if there's any questions, as you said, we will endeavour to answer those either through the chat or by email. So if I could have the next slide, please. So thanks to Sue for setting up all the data and the activity, and we didn't join up on this at all. So, but I think it sort of follows on nicely. So what I've done here on this slide is just show you all the services and the pathways that we deliver across Kent and Medway. So all referrals come in through our single point of access. So any children and families can refer into this if they're in crisis at any point. That's the number there. And they can also do an online referral as well. And Lisa will talk a bit more about the SPA process in her slide. There are 9 Kent locality teams, which are all listed there, which we cover all areas. And those are the pathways. So mood and anxiety, behavioural and conduct, and complex pathway. The crisis team deliver a 24/7 service, which is the same number across whether you're single point of access or accessing the crisis service, you use the same number. We also deliver services for inpatients at the Kent and Medway Adolescent Hospital. We've got 11 inpatient beds, and we've now got a 1 place of safety bed as well for young people who require that for a period of 24 hours. We also manage the all-age eating disorder service, and has been alluded to earlier, we've seen significant increase in referrals to all aspects of our areas. We deliver developmental and learning disability service, and that includes ADHD, ASC and LD. We're now delivering mental health support teams in schools, which is a new, relatively new and progressive service that will develop into the next couple of years. So the next slide, please. So our response to the pandemic, we continue to operate business as usual because you know, young people and families required the service all through the COVID period. We had to change the way that we worked, so we had to change our services on our clinics, and we turned very quickly to virtual and digital means to support families at this time. We also did face-to-face consultations because, you know, it's not always possible to do a virtual digital assessment for children in absolute crisis. We offered group therapy and support via digital, including parental support, and we brought in lots of initiatives. It's been a very, very difficult time for staff over this last 18 months, and that has health and well-being with the acuity and complexity of the children that we have been seeing. We've worked very closely across the system with the CCG, so we have secured funding for crisis, which Kat may be able to allude to on her slide. And we've worked, I have to say, the system in Kent and Medway, I think, has really come together to support us, and we've worked very closely together, education, social care, and the acute to deliver appropriate service to our young people and families. There was an insignificant and continues to be increase in children requiring acute services and inpatient beds, but we've really worked hard to prevent some of the children going into those areas. Next slide, please. So sadly and unfortunately, in 2020, there were 3 children who completed suicide under our services in Kent and Medway. there was a theme of males between the age of 13 and 16 with a history of ASC and ADHD, and also comorbid mental health issues. This has, obviously significant impact on the families, but it really has a significant impact on practitioners and the teams across Kent and Medway delivering these services. And we try very hard to support everyone at this time, and we're very grateful from the support from the system as well when these incidences occur. What we did following these suicides, we very quickly learnt some lessons. We provided face-to-face follow-up assessments for young people within the 7 days of presenting with a crisis presentation, attendance at A&E. We strengthened our communication between clinicians in different teams, that's internally, regarding the profile of patients and their presentations. And as I've alluded to, the fortnightly system calls, including education and social care across Kent and Medway, were really, really supportive. And we also took on a big project internally to contact over 2,000 of our families between those age range 13 and 16 to speak to them and offer support if needed. Next slide, please. I'm going to hand over now to Lisa just to talk a little bit about the NELF SPA. Can't hear you, Lisa.
Hello, is that better?
Yeah.
Oh, lovely. Okay, thank you, Sandra, and thank you, Tim, for inviting us to speak today. So I work in the single point of access, which is ultimately a referrals team that manage the emotional wellbeing and mental health referrals across Kent and Medway for children and young people. I think generally there is a perception that SPA is a referral to CAMHS, but actually we're much more than that. So the single point of access aims to direct requests for support to appropriate services. That includes services, universal, targeted and specialist mental health services, as well as agencies outside of our own trust and CCG. And I suppose that sort of echoes this idea around suicide prevention, and the early intervention is quite key and quite critical. So what we have to know in SPA is how all services interface with each other and map out across Kent and Medway. So it's quite a task, but the aim of the game is to make sure that young people aren't on waiting lists that they don't need to be on, and that they have easier and timely access to appropriate services. So as the slide suggests, NELF SPA, we open from 8 AM to 6 AM, but outside of these hours, our number is still active, and it directs to a service called Mental Health Direct. And this is just to ensure that anyone that needs support at any time can have access to advice and guidance. All requests for support that we receive basically get entered into a generic inbox where we have a senior clinician screening these requests for support. So ultimately this is ensuring that we're checking information around risk and presentation, and that we can sort of direct these referrals to the appropriate places as quickly as possible. So that might be to internal services such as our neurodevelopmental team, our local CAMHS teams. Perhaps it needs more of a conversation to find out what's appropriate for this young person, so it might go to the SPA caseload. So all requests for support we aim to triage, and that's a telephone triage. And I suppose what's quite clear in terms of the request for support that we do get is that children and young people are quite complex, and they don't stand in isolation. So often their emotional wellbeing problems can be consequential to wider systemic issues such as housing, parenting, safeguarding issues, and sort of developmental conditions as well. So young people are not very clear cut. So in SPA, we need to have a good knowledge of wider systems and child development to make good decisions for these young people. So during the pandemic, SPA received a great deal of referrals. I believe Sue's slide covers it quite significantly in terms of, we received double, if not triple, the amount of referrals that we ordinarily would. And part of the challenge over the course of that time is how do we manage demand and also provide a good service for service users and families. So what we're trying to do, as always, is to try and have a timely response with managing requests for support, and ensure that we're trying to contact all the families and professionals that need to be contacted to make good decisions about the appropriate level of support for children and young people. I think that's all from me, Sandra.
So, thanks, Lisa.
Okay.
So we go to the next slide, please. And Isaac, if you're there. So this is just, Isaac's going to just take you through some of the things, because we did have increased referrals for continue through the neurodevelopmental disability service. Can't hear you, Isaac. Still can't hear you. Okay, so so we've worked, as I said before, we've worked very closely with commissioners, and we were able to transfer our 16, 17-year-olds over to Psychiatry UK for ASC assessments, which was really helpful. We introduced some more training for staff. We've had additional funding from the CCG to expedite some assessments, because this has significantly impacted through COVID, and has really impacted on families and young people. We increased our virtual drop-in sessions. We've also now got a consultant pharmacist and nurse prescriber, which is helping with our prescribing processes, and we have commenced a shared care pilot with our GPs around prescribing. We could have the next slide, please. So this is what I alluded to earlier. This is just to tell you about the exciting developments of the mental health support teams, or the Kent Emotional Wellbeing teams, which will be based in schools, in our education settings. So these will be the preventative, lower level care and support that we can offer to children. So some are already live, as you can see there from last year, and there's some exciting ones in Thanet and Canterbury that are coming on board. I just quickly want to bring Kat in at the end, who is from our crisis team, just to give a bit of an overview of the crisis team and what happened in COVID.
Hi, yeah, can you hear me? Hi, good morning, everybody. My name's Kat. I'm the manager team. So yeah, just to say that throughout COVID, I know that Sandra's touched on it, that we have worked as business as usual. So that has included us seeing young people face to face in their homes, in the community, schools, in the acute sites, and that has also included seeing COVID positive patients. We felt it's been important to kind of maintain that face to face contact, to kind of build that therapeutic relationship, and to support those young people through their crisis period. As we've said, we're a 24/7 service, and we cover A&E liaison. We offer a community home treatment support package. We support young people on a section 136, and we gatekeep admissions to tier 4. So we cover kind of like a wide variety of services that we offer. Throughout COVID, we've definitely seen an increase in kind of complex cases that have required admissions to acute wards and to tier 4. And we've noticed that these cases have required more intense support from the crisis team, locality teams, and other professionals. And that has included social care and specialist services too. And we've all worked collaboratively together to achieve the kind of best outcomes for those young people. I know that Sue and who previously spoke, and Sandra has highlighted that we have seen some developments across the crisis pathway recently, and that will continue moving forward. So recently we opened the Children and Young People's Health-Based Place of Safety. So that's for any young person detained on a 136. We now have a designated safe and I would say dedicated safe space for them within NELT for them to be supported through that process. We've had the increase of workforce, which has been allowed us to kind of respond to A&E referrals in a more timely manner. We have had the increased workforce, which we're supporting for a mental health worker on the acute wards, which has supported the acute trusts in dealing with the increase of the admissions. And moving forward, we're looking at the development of offering a home treatment team offer with therapeutic skills and interventions. So there's a lot coming up, which is exciting for us within the crisis